Hi, my name is Alexis Siegel, and this is my case connection presentation for Unit 2. These cases are more of a clinical application to the material that we've been learning thus far in Unit 2. So the two cases that I've selected out of the four are cases number 3 and 4, so hopefully my explanations will um, fully explain my understanding of these two concepts. So the first case that I've chosen is case number 3. The case is as follows. A 5-year-old boy is brought to the pediatrician's office for an annual visit. The mother reports he has been a sickly infant and often appears drowsy. She also has concerns of her son's persistent thirst and frequent urination. Blood samples are taken for insulin measurements at time 0 and 1 hour after a glucose loading test. This is a typical test that a healthcare provider would give to someone who displays glucose metabolism issues or pathologies in this area. So the results of the 5-year-old boy's testings are as follows. So here you can see the baseline blood sample. So you have the patient's results as well as the control. So the patient's results are zero point 0.8 as compared to the control, which is 6 plus or minus 2. So in the control, in the normal range, the lowest would be 4 and the highest would be 8. So zero point 0.8, as you can see, is extremely low, much lower than the normal range. So that is concerning in itself. If we move to 1 hour after a glucose load, um, sorry, 1 hour after a glucose load, the patient had a result of 5, whereas the control is 40 plus or minus 11. So again, this is extremely low in this area, and that yields for further concern. So what is this information likely to suggest about the underlying biological basis of the patient's symptoms? So as I just explained, the lab report data is abnormal and a bit concerning, as the baseline blood sample of the child is zero point 0.8, and that's significantly lower than the normal value. And for 1 hour after glucose loading, the patient's level is about 5, which is also below the normal range. What would you predict the patient's fasted blood glucose levels to be given his current condition? So, as well as the information that I just discussed, other symptoms presented in the patient, such as increased thirst and increased urination, um, I feel that a healthcare provider or I could diagnose this boy with diabetes mellitus, specifically type 1, just given the fact of his age and his symptoms presented. It's more likely to be type 1 than type 2. Based on this diagnosis, we could conclude that a fasting blood glucose tests were done. The boy's glucose levels would be above the normal range, as seen in a typical type 1 diabetic, because these metabolism pathways are disrupted. Less 2 regulatory enzymes that are likely to be active in this individual's current condition. So those that I've chosen are hexokinase and phosphofructokinase, both present in a typical glycolysis pathway. The second case I've chosen is case number 4, which is as follows. A previously healthy 2-month-old female presents with jittery spells after several hours after breastfeeding. Her mother reports she has not given the baby anything to eat other than breast milk since birth. The baby has only recently been sleeping for more than 2 hours between feedings, and that's when the mother reports the symptoms started. Laboratory results are consistent with hypoglycemia, which is low blood glucose, but are otherwise unremarkable. Epinephrine is administered, and there's no increase in blood glucose, but there's an increase in blood lactate. Physical exam reveals a liver edge 4 centimeters below the right costal margin. Percussions of the right chest and abdomen confirms hypomegaly, which is an enlarged liver. blood glucose levels increase after breastfeeding, but she cannot maintain blood glucose levels within a normal range during fasting. So the question following this case is based on the information above, which of the following is most likely the diagnosis of the patient? So we have A, hereditary fructose intolerance, B, galactosemia, C, glycogen storage disease, which is the inability to use glycogen, and D, glucose 6-phosphate dehydrogenase deficiency. So, given the information and the case, I was able to go through each of these options and determine the correct answer as well as why the others were incorrect. So, the correct answer I've determined to be correct is C. So, major reported symptoms include low blood sugar levels, and high level of lactate, fats and uric acid present in the blood and in the large liver. So all these symptoms present in the baby match with the diagnosis of glycogen storage disease. Other symptoms that I've researched glycogen storage disease to include are bone thinning and delayed growth, as well as delayed onset of puberty. So these are things that may not have been mentioned in the case given the age of the individual. It's obviously very unlikely that this age of an infant would have hit puberty, so these signs and symptoms may have not presented themselves yet, as well as bone thinning. I've read that that is obviously a gradual process, and if the baby is extremely young, very close to newborn age, then this obviously wouldn't have presented itself either. But if the disorder were to continue, the baby would likely display these symptoms later in life. So now I'm going to go through the reasons why A, B, and D are incorrect. So why not A? The common symptoms of hereditary fructose intolerance include chronic fatigue, malabsorption of certain essential nutrients such as iron, nausea and vomiting, and gas and abdominal pain. So none of these symptoms were pointed out in this case, showing that this would clearly not be the proper diagnosis for this infant. So for similar reasons to option A, the symptoms for option B do also not match that of the case. So common symptoms of galactosemia include loss of appetite and vomiting, and neither of those were reported by the mother or the physician in this case. And lastly, option D doesn't really present itself to be the correct answer because glucose 6-phosphate dehydrogenase has symptoms of fatigue, back and abdominal pain, yellow tinted eyes, and dark urine. And none of these 4 symptoms have been also presented as an issue in the baby. Therefore, the correct answer is C. And this lastly makes sense because if we go back to the case here, if the only method of consumption of nutrients is through breast milk, it's very likely that that there would be an issue with glycogen, as this is one of the primary sources of energy within breast milk, and so the inability to use this glycogen through the process of breaking it down would cause one to believe that this is a glycogen storage disease, as this is the main component in breast milk. So thank you for listening to my case connections for Unit 2. I have attached my script as well as the PowerPoint to this recording, so hopefully that will be helpful. Thanks.